if you know that you take any morning after pill, be it postinion 2, post pill, or if you are on any contraceptive or any family planning rather, be it implant, IUD, in fact, any type of contraceptive, even if it's that injection, my girlies, come closer. My mamas, in fact, if you are seeing this video and you fall within this category, come closer. This video is for us. Now let's dive right into it. Welcome back. See, we all know that contraceptive, which is like our today topic, is, will I say, is a form of birth control that is used to prevent pregnancy. Yes, it can be an invasive procedure, or in fact, I don't know, but trust me, contraceptive itself is like a form of birth control. See, this is a topic I've been wanting to talk about. Yes, I've talked about different types of family planning in my old video, but you see this morning after pills, implants, injectables, IUD, guys, this is a topic I have been wanting to talk about. Yes, and I'm glad that I get to do this. See, even if you don't watch any of my video, my girl, is come closer, because these morning after pills, implants, injectables, and IUDs are doing more harm than good to our body. In fact, our today's topic is the harmful effects. In fact, I have to fit it somewhere. In fact, let me just write it goodly here. Harmful. Yes. The harmful effect of this morning after pills. Trust me, I had to take my time, read on this, and I'm not here to speak grammar. No. I'm not here to confuse you with English. See, I'm going to try my best to break it down to even a layman can understand it. Yes. See, as a lady, the most common, or will I say the most popular one that is being taken by ladies, young girls, is this morning after pills. You see this morning after pills, you see your postinion, your post pills, your levonorgestrone. They all fall under this morning after pills. Guys, if you are a lady and you are taking any of these pills, please stop it. Yes, take it from me. I'm a nurse, and I'm advising you as someone who has, will I say, I have even used myself as an experiment. Even those around me, I have asked questions, more like I've done survey. I want you to stop. Now, you see this morning after pills like you're posting on too. If you notice, some of you, when your period is like, maybe you are used to seeing your period every 12th, 13th, 14th, and all of a sudden you are seeing your period on 1st. Trust me, it's as a result of this morning after pill you took or you are taking. We know that they are emergency pills, but my ladies, I want you to stop it, because trust me, the risks of that, this, aside it changing your period or changing your period date, your cycle length and everything, it can cause cervical cancer. It can even cause depression. Let's not even talk about acne. It can cause that, trust me. See, I don't want to even beat around the bush. I don't want to talk too much or speak vivid grammar. I just want you to know that if you are taking these pills, its side effects include cervical cancer, depression, acne, mood swings, in fact, low libido. Yes. We are moving to the next. We are not wasting time. Now, the next on our list is implants. You know, implants can be the one that is being placed under the arm. We have like 5 years, we have 3 years, and we also have for 2 years. See, take it from me. I'm telling you, I did these implants. Yes. I know that they'll say, oh yeah, it's good for me. Trust me, for some persons it's good for them, for some persons it's not good for them. But generally, it is doing more harm to our body than good. Now, for I myself, I was on implants for 3 years. And you don't want to know what it did to my body. Now, I did that survey on my own self. Yes. I was on implant for 3 years. And for those 3 years, I suffered from severe back pain. When I mean severe back pain, I don't know if I didn't know at that point that that was the cause of my lower back pain, because I noticed that I suffered from a very severe back without doing nothing. Yes, in fact, I will just stand and my back's been. If you watch me, if you know me for those periods, I'm always like shooting my back. I will complain to my husband that I'm having lower back pain, lower back ache. Where is this lower back ache coming from? Until I made my research and I saw that this implant was a very big, in fact, contributed about 90% to that lower back pain. And since I took it out, my girlies, trust me, I have returned to my normal self. I can't remember the last time I complained of having lower back pain, except maybe I overstrained myself, yes, of which that is normal. But having a lower back pain anymore, no, I no longer suffer from that. Yes. And another side effect of this implant I noticed for myself was that I had acne. When I mean severe acne, there was severe acne. The moment I took out that implant, my face became better. I suffered from very severe cystic acne. Yes, I will not talk much. Now, you see another side effect of this is that for the persons I was able to add, because I didn't just want to do just reading books or using my own knowledge, I needed to ask persons. It's more like I needed to do this survey. I needed to ask mothers. I needed to ask colleagues. And one of the mothers I asked said that she bled. You know, when they say there was an unusual bleeding, for example, if her period was supposed to last for like 3 days or 4 days, she bled for like 2 weeks. Why? Why are things that are supposed to help us harming our body? She bled for 2 weeks straight. Now I asked another mother and she told me that for that 3 years straight she was on this implant, she never saw her period. Like, I don't know. See, like I said, I'm not speaking big English. I'm coming with facts and I want you people to understand. That is why I'm not even here to speak grammar for you people. Yes. Apparently, this implant, sorry about that, let me fix this well. Apparently, implant that she was on for three whole years, she never saw her period. Like, how will you be on implant and you are not seeing your period? Something that they claim to help as a birth control, you are not seeing your period for a whole three years. And I needed to ask and make my inquiry, although it's more like it might be normal according to research and according to scientists that it's okay if you are on implants, your period might not be present. It's more like your body, because of this, the hormone present in the implant, it sends signal to your brain, thereby making your brain and your body feel like, oh, you are pregnant. As that period ceases, meanwhile you are not pregnant. It just tricks your brain that way. Why? Not seeing your period for 3 years when you are not really pregnant, making my brain to feel as if I'm tricking my brain to feel like I'm pregnant when I'm not pregnant. Mothers, please, if you're on this implant, take it out. You are doing yourself more harm than good. Yes. Now we'll move to the third one, which is the injectables. I don't know if you are saying it. Injectables. You see those ones they give you for 3 months or 2 months, those injection called Depo. You say, I want to take my Depo shot, which is the Depo Provera. Trust me. I feel like for the persons that I've asked, that have taken this Depo shot, one of the side effects that I have recorded from mothers and these individuals that have been on this injectable is infertility. Yes. Infertility longer than 2 years, 3 years, 4 years. Some of them are not even able to conceive again after taking Depo shot. Why? When we say birth control, meaning that a method of trying to like help us space our kids when you are ready. Do you understand me? But not making us infertile or making us not being able to conceive. Although that studies have shown that none of these birth control method or contraceptive are able to prevent fertility or able to cause infertility. But studies, I don't know, will I say findings, and my own survey has gone to prove, in fact, prove those scientists wrongly and even our textbook wrongly that they can cause infertility. Now, I know a person that took these injectables. She just took this Depo-Provera for like twice, a shot for like twice, which is 3 months. That's like 6 months, which is twice in that 6 months. And she has been trying to conceive, and it has proven abortive. Like, she has done all the tests and everything, but she has not been able to conceive. And I don't know, to me, although yes, she's currently seeking medical the correct care and help that she needs, but Depo-Provera, one of its side effects is causes infertility. Then another one is it causes bleeding. When I mean severe bleeding, yes, because why will you take a Depo shot and when you are on your period refuses to stop, more than lasting for almost a month? I still don't understand. As I said, if after watching this my video, you still go back and take your Depo shot, or after watching my video, you still go back and take your post pills or any other one, you are clearly on your own. Now, the last on our list is IUD, which is the intra-urinary device. If I am to advise a mom, or I'm to advise my girlies, if there is any form of family planning you want to do, if at all that you are not able to go through other routes, I would advise you even do this IUD. IUD is even a little bit safer, although there is almost like a 5% chance of it failing. Yes, because will I say it is non-hormonal. It has this IUD is more of this shape, has this like T shape with its tiny strings, whereby it's being inserted. So if you were to do, for my mamas, I think you can go on to do this IUD, which is your intraurinary device. You can go to your health centers, you can go to your hospitals and talk to your doctors. They will be able to help you and guide you on these IUDs. Please, as a young girl and as a young mom, if you know that you are not yet done with kids, you have no business with any form of family plan. Absolutely. If you are not done with childbearing, or if you are within that age of childbearing and you are not yet married, you don't have any business with any form of contraceptive, be it injectables, be it the morning after pills, be it the implant. You don't even what they call itself, those, I've forgotten the other name. In fact, you don't have any business with any of them. Yes, if you know that okay, you had a baby and you want to space your child, that is the reason why you need to learn how to calculate your ovulation period in order to avoid pregnancy. You need to go the natural method, or better still, your husband can make use of condom in order to prevent pregnancy. There's even a natural method. You can even use the bead method that is being used as of old. Instead of you trying to space your child, maybe you just have a child and you went on to take either the Depo shot, which are your injectables, or you went on to be on 2 years implant, on 3 years implant. Trust me, and when it's now time for you to conceive, or time for you to now have another child, you are finding it difficult. So it's better to be careful than sorry. Go through the natural method by either you making use of you can make use of your calendar method, the bead method, or even let your husband make use of condoms. Yes, I came here to make this video to tell you, to teach you. Not after teaching you, you go back to your morning after pills. Trust me, you're gonna cry and you're gonna learn, and you will learn the hard way. So thank you guys. If you are new to our channel here, don't forget to subscribe, turn on your notification button, and I'll see you in my next video. Bye bye.